one of the things that I was so concerned about in the pandemics, particularly with masking of the little ones, was, well, one, we're teaching our children that everybody's dirty, right? Like I remember pulling my kids out of they were in a school. I pulled them out of it because they had to be before it was closures. It's like they had to be masked. If they went outside, let's say they went to the bathroom, they would have to sterilize their hands coming back in. No sharing of crayons, no sharing of pencils, which is where, everyone's like taking someone's eraser and whatever. And I said, I don't want my kids to learn that. I don't want my kids to learn that everybody else is dirty. Or we have some boogeyman, there's some germs. But the other thing that I'm concerned with, and I'm sure that there are a lot of speech language pathologists that might agree with me, at least now, is the language delay. When we are not able to see the full face and to see the full expression of someone's face, to see their lips moving, let's say, that delay of language acquisition, whatever language it is, English, French, Spanish, whatever, I think impacts the child's ability to acquire language and to use it appropriately. And I think also their EQ, right? So they're in their emotional quotient. So we talk about IQ as how, quote unquote, smart you are. Like book smart, maybe you are. But I think that there's that emotional quotient, your ability to read faces, your ability to read the room, so to speak, right? If I look at you and you have a frown or a scowl or, yeah, exactly. I'm able to read that and say, oh, okay, he's not happy. So I need to figure out what's making him, what's he reacting to. I think that was also very much, attenuated in our beautiful kids. And then not to mention, and I'm sure your wife and you have spoken about this, the mental, like the anxiety, the depression, the isolation that so many kids feel. So many kids missed prom, they missed their proms. They couldn't dance with, what, tell me a little bit about the conversations maybe you and your wife have had, maybe what I'm sure you've also seen this in the ICU as well. We have the data on it, like increase in suicidality, suicide attempts and ideation. What is your estimation in terms of the impacts on our children from some of these closures and extended masks, even on university campuses? Some of them still do. I mean, some of them still have mask mandates on campus.
Yeah, there's so much here. Number one, okay, this was a population gracefully that was very low risk from contracting severe COVID, right?
Mm-hmm.
As an example, you're in Toronto right now, T dot.
Yeah, I'm in the six.
Yeah, in the six. If you were driving, you have two boys.
Two boys, yeah.
Yeah, you drive your boys from there to Ottawa, my house. That was more dangerous. That was more of a threat than COVID ever was in terms of mortality risk. Okay, so why the hell were we putting all these interventions on the kids when, once again, these restrictions, these measures can have such a devastating impact on their future, and it could be generational, especially mental health.
Yeah.
Talk to any mental health professional how that can affect families, not only the kid, but the kids are the family around them, time off work, the amount of money and needing to invest in, whether it be therapy, the medication, what have you. This is a big deal, right? And to download that on the kids was insane to me. And a lot of people at the time, they were saying, well, as an example, masking the toddlers. Well, we have no data to support that it's going to be negative. But do you want to wait for that data? Do you want to wait for the data to see that it could affect their language? Yeah. It could affect their EQ, as you mentioned. I had no doubt. My youngest, he's now 5. I have no doubt his speech was delayed as a result of being being masked when he had to be. I have no doubts about that, because just going through my other kids and the kids around, I to me, this was crazy. And then the other aspect of it too, remember when little Zeke was maybe 2 years old, somebody, well, one of our friends was dropping by the house, and it was in the midst of or tail end of one of the waves, and the little toddler was running towards the adult, and the adult stepped away, as in like, oh, the kid is gonna be like, watch out, it's a vector of disease. And I'm like, you need to leave this house, because the kid's not gonna be exposed to this, because that lesson is gonna that has a risk of sticking with them. And I'm here on this earth to raise my boys in the best way possible, and to also protect them, and that just like it's one of those things I'll never forget, because it's like, this is where we're at now, or at the time. This is not right. Yeah. Okay, with COVID, the beautiful thing about COVID was the data was so clear throughout. Here, who needs to and don't get me wrong, like, I don't want anybody to come out across this and say like there's a COVID denier. Like, I treated and saw many patients unfortunately die from COVID, but my point is, it was very predictable on who was not going to do well. Okay, there's patients that we
and
knew.
So what were the factors? You mentioned age.
Yeah, so like extreme age, and even the ones that were extreme age, and this kind of varied during waves, but like, say the earlier COVID waves, if you're extreme of age but also probably had some level of comorbidities,
okay,
that was one. If you were immunocompromised,
so like dyslipidemia, like in the metabolic realm, right? So we're talking,
or even like say you were 93 from a nursing home, maybe you didn't have metabolic disease, but you were not robust, like you were frail, like right. that was still somebody that could die from COVID. Mm-hmm. But extreme of age, and that even got better over time, by the way. Then immunocompromised, so they are on cancer treatment, they're a renal transplant patient, that we saw. And it wasn't all types, ironically. It was just specific types that, for whatever reason, seemed to do worse than others. But then the vast majority in the big waves were metabolic disease. You had either type 2 diabetes, you were obese, you were pre-diabetic, dyslipidemia, high blood pressure. Like, I still, to this day, have yet to take care of somebody that was completely healthy. To this day. And so, why not preach this?